Hey, welcome to this video. Are you struggling to find work in the NHS? Are you struggling to get back on your feet? You have a healthcare background. You could be a GP, you could be a medical doctor, whatever your specialty is. Or are you a registered nurse? Are you a physiotherapist? Or are you somebody who actually has worked in the healthcare industry and wants to go back, but you're not sure where to start and you are looking at your options? And perhaps you are at a place where you're thinking, I haven't got time to going through all the knowledge, all the information that I need. I need a way to make a decision quickly, right now, without wasting time. Welcome, you are in the right place. Listen, my name is Coach Meg. I am streaming this video from London and I have a healthcare background. I've worked in 3 different countries and I transitioned into marketing, supporting business owners, especially if you have a healthcare background, to transition from the healthcare industry to becoming a business owner or to becoming an entrepreneur. So I want to talk to you about some ideas that I think, if you really think about them, you will look and think, okay, I think that works for me. Because the trouble that I find, I'm in the online space for a while. I do my research as much as I can so I can help someone like you not waste time trying to find all the information that you need. What I find sometimes is whatever somebody else has done and accomplished may not be what you want to do, right? You can hear what they did and the success they got, and you're like, that's not really what I want to do. So you are in the right space. This is the idea that I thought I'll bring to you today, right now, so that you can think about it. Listen, if you have contributed to the healthcare industry, by the way, I just want to say thank you. I appreciate you. And sometimes we are underestimated for the contribution we bring to the human race. And it is what it is. But nonetheless, here are some ideas for you. You may be thinking, do I go back? Do I wait until a vacancy opens up? You can start empowering yourself right now and make some important and necessary changes, yes, that are going to make a huge difference in your personal life and in your career as well. Because one thing is, you don't want to lose your skill set. You want to stay updated with the knowledge that you need to stay on the register. Of course, we all understand that. So here are some ideas. If you are a GP, you're struggling to find work, here are some ideas you can start doing now. I want you to think about building your personal brand. And you might be thinking, what's a personal brand? A personal brand is who you are, what you stand for, what you care about, what your values are, what you enjoy, what gives you life, what gets you excited about life, the things you want to be involved in, the things you want to learn, the areas of personal development you want to get involved in. So we are complex human beings, right? We are also different. So we all have different ideas and interests and things that we care about, things that we want to learn, and things we want to unlearn. Yes? So I want you to consider your personal brand. Why this topic is important is what I have found, even when I have coached others, it's about the transition and the marketing becoming visible. Because as you build your personal brand, you're going to start discovering what you really enjoy, what you care about. Yes? And then build a lifestyle and a business around that. I hope this is making sense so far. So let me quickly get into it. If you are a GP, you have a medical background, here are some ideas for you. You can start doing health coaching online, one-to-many. Because you've already got the training, the qualification, the skill set, your people skills, hopefully. Because sometimes it's difficult, right, to work with difficult patients. But generally, those of us who are in the healthcare industry, we have people skills. They may not be 100%, but we care about people. So you can start doing health coaching and you can start doing this online. Yes? It's just about understanding what you need to put in place, what's the knowledge that you need, the information that you need, and start that business straight away. It doesn't have to take a long time. You can register the business and start consulting with patients. Because listen to this, the NHS is already understaffed, right? Because what I have found in my own experience, patient education is not as widely spread as it could be. A lot of people don't know how to cut back their hospital visits. If a lot of people understood how to manage their own health at home without having to see the GP every month, yes? And it's not people's fault. Sometimes they just don't have the knowledge, right? If there was more information, we could cut back on hospital visits. But we also know human behavior. I've worked in the field, I've worked even in the community. Sometimes people are just not taking responsibility for their own health and well being. And that's something that I've understood by working with people. I'm like, wow, there are people who feel like the doctor or the nurse is the one who's supposed to take 100% responsibility for them. So, this will be your part as a health coach, empowering people, yes? Empowering people to take advantage of all the knowledge that is available, things that they can start doing, simple basics, right? Which you already know. You know, just like resting well. A lot of people would do really well if they rest well. They give themselves at least 8 hours sleep. And you would think this is common knowledge, but I kid you not, having worked in the community as well and having worked in the hospitals in 3 different countries, people sometimes take their own well being for granted. They just assume they're going to be okay. Yes? And even for myself, there are times I have to catch myself and like, this is time to rest. This is not time to be reading another article. This is not time to start doing another live stream, which as marketing, something that I enjoy. Sometimes I get carried away and I'm like, no, I think I'm done for the day. So that's one of the things, yes? So health coaching is such, you can, let's be honest, you can easily do 7 figures with that. Listen, if what I'm saying so far, I've just given you one example, you're like, this seems interesting. I want you to get in touch with me. There's a link somewhere here, somewhere on this video, and I'll send you some resources so that you can start making a decision straight away. So you're not wasting hours on end trying to figure out what am I going to do. You know, nobody wants to waste time like that because I know that time is important for us. Yes, for all of us. And I know you don't want to waste any time. So I've actually got a list for you to give you some guidance and support. It's free, don't worry about it. And you can start looking at, what's working in the marketplace now because that's part of my work to do the research, what's working, what's not working. So get in touch with me. There's a form that I want you to fill. I'll send it to your email address. It's only by email. Yes? Okay. All right, another thing you can do here's a second idea. You can start selling online, selling hospital items, hospital beds. You can do these as drop shipping. You can sell wearable devices. You can sell vitamins, supplements that are well sourced. You've done your research. You don't want to just sell whatever. You want to sell products that they've been tried, they've been tested, and you've checked the suppliers. And some of them that you already use, actually, which is even better. Because if it's something that you've already used, that's even better for you. But some products that are on the marketplace, because of your healthcare background, your medical knowledge, you'll be like, this is a good product. So you can do your research and start drop shipping. And this won't cost you much, but that's e-commerce for you. There are so many products you can start selling on there. You can start selling fitness products that you can include in that because you'll be coming with this mindset, right? Helping people to avoid hospital visits, helping people to prevent long-term illness for taking over their lives. Having worked in the community, oh my goodness, it was just like, and because of compassion, right, and understanding where people are, we have to support people where they are. But one of the things that I'm really passionate about, especially working in the community, is not to make a person's condition worse, but to make it better. So what can somebody start doing? I've looked after patients who had catheters, at home, people who were dealing with long-term hypertension, so chronic kidney disease, and what's their lifestyle, and sometimes they're also dealing with their mental state. There is so much under the health coaching that will be just, but you see, what I love about doing this, right, health coaching, is you actually get a chance to spend quality time with patients more than when you're in the hospital or as a GP when you've only got so much time for each patient, yes? But when you're doing health coaching, you can plan the support and the care of your clients and your patients way better than under restricted time. Yes? Okay. And this is something you can be doing part-time while you're waiting maybe for a vacancy to open up. And I'm not saying you have to walk away completely. If you want, you can go back doing 3 days a week. But doing these ideas is going to be a game changer for you. Okay, so we talked about health coaching, e-commerce. Here's another one. You can start selling digital products. Ooh, this is the knowledge that you have gained from working in the healthcare industry that people desperately need this knowledge. Because you look at the numbers, you see how many patients you've seen. If people knew this, they would reduce their times to, going to the hospital. And it's true, people sometimes don't. But listen, here is the thing. It is about working with people who actually care about their health. This is not about trying to work with somebody who doesn't want to make their health better. This is about working with people who actually want their ideas, who want the knowledge, who are proactive about their health. Okay, then, so that's the digital products. These, are different websites. Like I said, I'm going to send you the link. I need your email address. Don't worry about it. You are only going to get coaching support, tips and ideas as part of the email list and the community that I'm building for those of us who are entrepreneur minded, who have a healthcare background, but we are entrepreneur minded. And believe you me, there is such a learning curve, how to become productive, how to manage your time better, how to stay on the learning curve, how to join a mastermind of similar people who are on the same journey as you. Some people have ended up walking away from healthcare altogether. There's a doctor that I've been learning from, several months ago. He totally left medicine and decided he's just going to be doing educational marketing, and he's a content creator. So I've got some resources for you. Get in touch with me. There's a link somewhere here. Okay, another one is you can become a content creator. And you may think, oh, where's the money there, Coach Meg? The money there is because of the content, the helpful ideas that you are sharing and you are promoting and you are talking about. This ties in with another thing I'm going to add to my list. You become a health writer. And it's not on every website. There are some communities that are already online that would value your knowledge. Yes? As you start sharing this knowledge, other people are going to contribute to what you are talking about. And as other people are contributing, you are building a network of peers. The opportunities here are endless. This can turn into a membership site. This is not even hard. You just need the right knowledge and the right support, and to build the confidence to do it, to start executing. And a lot of repetitive tasks you won't have to do. You can get a virtual assistant to help you with this. Yes, so a support network is a big deal. It's a huge deal. This is something that you can do even beyond retirement, because say you may be the kind of person who wants to stay updated with the knowledge that's relevant in the marketplace. What's the research saying now? Because you've got time and you can become the lead in that network because you are a content creator and you care about the health and well-being of people. This video is actually really for those kind of individuals who it's more than a job for you, it's more than a career for you. You really care about the well-being of people. You really care that people are getting better. You really care about reducing hospital visits because, as we already know, the NHS can't cope with so many people that are turning up in the hospital. So we have to take our own proactive approach and become entrepreneurs. We are deciding we are problem solvers. We want to contribute, to the problems. We want to be part of the solution. Yes, not part of the problem. All right, so that's becoming a content creator. Another one is you can start providing a travel concierge for high net worth individuals, leaders around the world, ministers, private individuals whose net worth people can't even know, but they need somebody who's got the experience, they worked in the healthcare field. You can start providing that service for them from the time they start planning to go for surgery, or they need to go for a health retreat or whatever it is, or they need to have major surgery done in the United Kingdom, of course, the country that so you can support them from the time they're preparing to the time they getting on the flight, and the time until the time they are in hospital, the time they leave hospital, throughout. That's a service that you can provide. It is amazing the opportunities that are available. It's just about changing the mindset from working in the hospital to now being an entrepreneur, standing on your own 2 feet. And don't worry about it. You always have the right support, because as you are active, as you're networking with others, as you're finding information like this one, you will always have a group of peers who understand how the marketplace works and how to attract the right clients. Part of what I do. Okay. Then another one is you can do what I would call It's like you are mentoring and coaching other doctors who may be working in underserved communities. Yes, it could be remote communities. So you can be providing a consultation for them, supporting them, where you're doing like a weekly or every 2 weeks. You are speaking with these doctors. They're working in a remote area. They don't have the facilities. They don't have the equipment. Your part would be to support them with that. And there are so many ideas around that. It's incredible. Fundraising and doing. There's so many things you can be doing. TED Talks. You can become a speaker, right? Advocating for those who are in underserved communities, doctors who are struggling. The ideas are endless, but you have to have the heart for this. Yes, you have to have the willingness, and you will be well compensated. Because if you know how to raise funds, if you know how to present cases, oh, there's so much good you can do in the world. Do not feel like you are limited to where you've been working so far. There's so many things you can do and serve the human race, contribute to the problems in the world. That's why we've worked in healthcare, many of us, right? Okay. Another one is you can start a digital marketing company, helping other doctors who have their own private practices, like a dentist, plastic surgeons, people who have decided to go solo. You can actually set up a digital marketing company for those who are in the healthcare industry, health and wellness field, health coaches. It is amazing. It is incredible. Right now, actually, I remember, listen, I'll send you the resources because I don't want you to be overwhelmed. There are people who have a healthcare background. They were doctors, they were nurses, and they've started contributing to the industry in a completely different way. It is radical where you just decide, okay, I can do it differently. You don't have to work the way you've always been working. But you know what I love about this? It's like personal management where you decide this is how I want to work, these are the hours I want to work, and these are the people I want to support and serve. So this is just incredible to me. It's amazing. Another thing is you can monetize your skill set. Now, let's completely go away from healthcare. What about your hobbies, things that you enjoy, things that you love, your things that growing up before you even went to med school? Because sometimes maybe you went to med school, you went into nursing because that's what your parents said. It was the case for me actually. And after a while, I was like, you can decide you own the career now, or you decide, you know what, this is not actually what I wanted to do. It's what my parents wanted to do. And of course we have to own the decision at some point. But there comes a time where you really think and decide, is this what I really wanted to do? Or was it my parents? Was it family members? Was it pressure from my family? So here we go. I am not saying you have to leave. This is just to address some issues that we all face and get challenged with. You may have an interest in fashion. And I know that may be like, oh, okay. Oh my goodness, the opportunities in fashion. With fashion, you can add travel. You can be doing documentaries around the world. You can be visiting other hospitals. The knowledge that you'll be exposed to is incredible. The travel opportunities, right? You can even work in a completely different countries, or you can even take a gap year, a whole year where you're building this business. Because number one, absolutely, I can already feel your objection. You're like, oh, I need to make some money straight away. Absolutely. We make a plan, like how quickly do you need to generate some income? So that's what the coaching is how quickly do you need? And that's up to you. It may be 30 days, it may be 6 months. It may be, oh, I'm good for now, but in 12 months, I want to be doing something completely different. So it could be fashion that you care about. With fashion, you can be a part of a bigger network where you showcase health, how to look good at a certain age, how to love who you are. Because of your background, that people respect somebody who's got a healthcare background, right? Imagine using that as influence, to be an influence for good, for change, for health, for positivity, where you're not under that pressure anymore to work so many hours because you're now working in your own time, where you plan your day ahead of time. Ooh, taking control of your time. That's amazing, right? That is just completely amazing. It could be cooking. I kid you not. I kid you not. It could be cooking, right? What are the best health recipes or health? What are the best meals for somebody who's dealing with chronic kidney disease? What are the best meals for somebody who's dealing with diabetes? What are the best meals for somebody who is dealing with irritable bowel syndrome, right? Imagine taking all the different healthcare issues that people struggle with, the long-term illness, the chronic illness, and then creating recipes and meals around that. It's mind-blowing, the ideas around this. And I'm sharing all this because I want you to think, like just, wow, there's a different way I can do this. I don't have to do things the way I've always done it. And these are ideas you've already known, but it's just like, I'm just here actually to just remind you. I'm just reminding you, to be honest. So you can start doing that, meals around that. What about fitness? You can add fitness to that. That actually also may come under health coaching, if you like. That may come under health coaching. And then what about your hobbies? Can you create a membership site around your hobbies? And because of your influence already, you will be shocked how many people you will attract to your membership community. And that is where my part comes in, to support you to get all this up and running. Get it in place. We position your personal brand, your colors, the writing. Oh my goodness, who do we need to be doing this and all that? There's a plan to get all this up and running in the shortest time possible, because I know that most of us want to save on time. And I know most of us realize our lives cannot just revolve around our work. We need to also think about our future, about our families and what matters to us, what we care about. Yes, as much as it is great to contribute to the well-being of our communities, but we also have to think, okay, what else can I do? What else can I do to create a bigger impact? Yes, because think about it this way. What is it costing you to not make a completely different decision? What is it costing you long term? Yes, for your relationships with your partner. Is it fair that, because I know there's a TV series, Married to Medicine, is it fair on your partner that they only get to see you once in a while? Is it fair that they should accept just a little bit of you? These are the stories we tell ourselves, like, oh, you should accept this. Do we prioritize our work over our relationships? Because who's going to be there when the rubber hits the road? Who's going to be there when it's time for you to leave this world? It's the people that we love and care about. And I think we need to challenge ourselves that it is not enough that, just because I have to work 12 hours, our families have to accept that. We have to make time for the people that we care about. Let people know that we value them, that they matter to us. And yes, there is actually a way to do that, which is another part that we can do in the coaching. Like, maybe you're listening to this and you're like, Coach Meg, okay, I don't actually want to change anything in my life, but I want to manage my entire life with where my life is at right now. Yes, so that's part of the coaching that we can do. How do we reduce the stress? How do we make sure that you are maximizing the time that you have? Yes, could you cut back on one day of work so that you can spend quality time with your partner, with your spouse, with your husband, with your wife, with your children, right? Because we might not be aware that sometimes our family members may feel we value our work more than them. And we don't mean to, but that's how it may come across. Okay, so having said all this, you are here thinking, okay, I need somebody who gives me the support that I need, somebody who's knowledgeable about the industry, the digital marketing space, the online marketing space. There's so many other ideas I could bring here, but I thought I'd just give you something to think about, something to get you, get moving, let's take action now. And because at the end of the day, we have to think long term, yes? We have to develop new habits, how we work, how we serve. And I was thinking about this even before I did this video, that when I look at the healthcare industry, sometimes I'm like, is it sustainable that we work full time? Could it be that is why there's a high churn? There's so many people coming and going, leaving, people leaving, working in another country. Or could it be that we can change this by we work part-time in healthcare and then in the other time we do our own thing? Is that maybe more sustainable? Could it be that we've been doing this for so long, we've never challenged it, we've never thought about it? This is just just an idea. Let me know what you think in the comments, by the way. Let me know what you think. Could it be that we change how we work? That maybe we wouldn't have such a huge shortage of staff, especially on the nursing side, if people didn't have to work full time. Maybe they work 3 days and then the other days they do their own thing. Could it be? Just a thought. Let me know what you think. Could it be that if we change the working hours, it may be more sustainable? I'm also into recruitment, by the way. If you are like, okay, look, I don't want to change anything, I just want to work somewhere else, and I haven't got time to be searching, get in touch with me. That's something that I can support you with as well. If you maybe want to work in a different country, get everything done, sorted, planned, less stress for you, or the relocating, wherever you are, all I ask of you is get in touch. Don't struggle alone. Don't struggle by yourself. There is support available for you. Listen, it's been so good talking to you, and I appreciate you listening to this. It is tough to work in healthcare. Like I said, I've worked in 3 different countries, and it can really take its toll on you. And I meant to also add, this morning, I saw a GP talking about how about 3,000 of GPs can't find work. They're unemployed in the NHS. And I thought I need to add that to one of the videos, the educational content that I talk about. It shouldn't have to be that way. I don't know if I mentioned this at the beginning, but just in case I forgot to mention that, I thought, people have options, people have opportunities, and it's just about taking charge, realizing if I can't change the system, I can change my system. Because while you're waiting for things to change, you can still get on and do something else. Yes. So I appreciate you guys. Looking forward to hear your comments, what you're thinking. And if you want to know more, you want the resource that I'm going to send you so that you can start taking action now. The resource really is to give you some ideas of how many people are doing all these different ideas that I've shared with you on here. Some of them, it may not be all of them. Some of the ideas I've given you here, which just to quickly recap, is you can start a private home care agency. I'm not sure if I mentioned that one. I think I forgot to mention that one. But in case I didn't, you can start a private home care agency looking after people in the community, the elderly. And to that, you can also add number 2, you can start doing health coaching, working with your ideal clients, people who are proactive about their own health. You can start, number 3, you can start selling products online, healthcare products, wearable devices. You can start selling hospital beds, which are drop shipping. You can start selling mobility scooters for the elderly in the community. People are living longer, so there's such a huge opportunity with the elderly. You can start selling, number 4, digital products, health information, what you have learned from all the work that you have done in the healthcare industry so far. What are the common problems that you have noticed? Now you can start providing the answers now. And remember, like I said, one of the ideas is it's about becoming visible. It's about promoting your brand, your services in such a way that the people who need to find the information, they can find you. And of course, you must make sure you're following all the laws and the legalities. If you need to get CQC registered, make sure you get that done. Okay, another one is building a support network by being a content creator. As a content creator, you're sharing this knowledge, the ideas, the challenges, the struggles of people in your field. You can start providing answers and solutions, and you can be collaborating with others who are in the same industry, right? These are things that you can do. You can start doing regular Zoom calls where you're meeting with other peers online on a regular basis. Yes, so that's number 5. And number 6 is you can decide to just be a writer, health writer. This is something you can do even beyond your retirement years. Yes. And with that, you'll be making money from books that you write. You can be making money from advertising space. You can be adding coaching to that. It's just about planning everything out, working with a coach. That's why I'm here, sharing this information, and I can support you on that journey. Another one is where you are supporting remote doctors or nurses who are working in underserved communities, who are working in remote communities. You can be providing some consultation, some support for them. And there's a way to get financing for that. You can work with, investors. You can raise funding because it's something that you care about, that matters to you. You can create an app so that others who are struggling in areas that are so far out, they can get your support. You can be raising funding. You can make such a huge difference in the world. Do not allow the limitations you've experienced so far stop you from making a huge contribution to the human race. Okay, another one is you can provide travel concierge to high net worth individuals, private individuals, celebrities who need a person who's actually a qualified doctor to help them from the time they book surgery, throughout the surgery, and the time they leave hospital, and the time they go home and fly back to wherever they are coming from, because they want to work, they want to have surgery in the country where you are. And I'm talking about the UK at the moment. And but this could be, because I know people who watch my videos, some of you are in Canada, United States, but this is an idea that you can think about. So you can provide the travel health concierge, and it's just about promoting your services the right way, and you'll be amazed. And then another one is you can create a digital marketing company for health and wellness companies, for other doctors, plastic surgeons, dentists, chiropractors, physiotherapists. You can create a digital marketing company specifically for people in the healthcare industry. It's something that I also do, actually. And there are so many skills that you can put to good use and not feel like you are limited any longer. Then another one is, which is completely going away from the healthcare industry, is your hobbies. What do you enjoy doing? What were you thinking of doing when you were a child, but you ended up doing medicine, or you ended up being a registered nurse because of peer pressure or pressure from your families? So you can decide, you know what, I think actually maybe all these challenges I'm facing are pointing me to completely switch careers. And I shared earlier on, there's a resource I'll send to you. There are some links I'll show you. People are actually doing this, and it's amazing to me, because part of my work, being in marketing and personal branding, is to do research. What's working in the marketplace right now? You know, the prices that people are willing to pay for the knowledge that you have. You can be helping people. This will go back to health coaching, who are struggling with addiction. Yes, there are people who are struggling and have realized consuming too much alcohol has hurt them, has damaged them. Some people are finally beginning to accept that when we are talking about avoid all this self-medicating, it's for your sake. It's not us trying to be judgmental or trying to take the fun from you. People are now willing to stop taking alcohol. People are willing to stop self-medicating because they have looked at their life and they've realized, I have an issue. And not everybody can afford to go into rehab, right? Some people, you can work with them on a weekly basis, supporting them. And because they are determined, they are your ideal clients, they will work with you, no issue, no struggle, absolutely easy to do. And when I say easy to do, what I mean is there is some work involved, how to build your personal brand, how to be confident, and how to network, and how to develop your people skills, because not all of us in the healthcare industry have people skills. So we have to look at that. We have to check, are we looking at people like, oh, you need to listen to me, or do we care enough that people are getting better? Do we care enough that somebody's life is becoming better? Because it's more than just having the qualification. It's about our people skills. Really important to understand. So your hobbies, it could be fashion. You care about fashion. You can start talking about and creating, you can start creating a fashion brand that speaks to people who want to live a certain way. People are living longer, that will inspire them to be more confident. There is a huge demand for seniors, senior models. And imagine your personal brand, because of your background, you create a huge following. You become influential. And you can be influential in the right way, because behind all that, your idea is to help people to live a better quality of life. Yes? Okay. So on that note, listen, thank you so much for listening. I thought I'll just do a quick recap. And if there's anything in here that I've said and you're like, you know what, I'm good to go, I'm ready, I don't want to waste any more time, I've got a coaching program that I'll work with you. That it can be 90 days, it can be 6 months, where you have to do an initial consultation where we look at what you actually want to achieve, where you want to be, and then I can support you to do that. We'll be doing some online events. If it means we have to do a local event, we book a hotel, a space that you're going to speak and do a presentation to your ideal clients, because we've been building your email list, and because you've been doing the educational marketing, you're attracting the right people. That is something that I can support you with. And it may mean that you just want to start an email newsletter. So there's so many things that you can do. It's just about getting the right support, the right knowledge, and just run with it. So the coaching can be 3 months, 6 months, 12 months. It just depends on what you want to accomplish. And we are going to do the research together. This is really about co-creating and me supporting you to accomplish what you want to accomplish, and making sure that it happens, because it's about supporting you to stay accountable. Yes. And that there are so many ways for you to do what you do, that you don't have to be restricted, and you can get to 7 figures. It doesn't have to be the same way. You don't have to struggle with the same thing. And I hope with what I've shared now has helped you understand that you don't have to do what somebody else has been doing. You can look at your own resources now, your skill set, what you enjoy doing, the health care department that you enjoyed. Maybe you enjoyed theater, right? Maybe you enjoyed the critical care department. I worked in the ICU, and that organized chaos. That was good fun. It had its time for me. Maybe you enjoy orthopedics. Yes. Maybe you enjoy the medical side of it, about giving medication. Maybe you enjoy the lab side of things, investigating, checking what the bloods are, and what's the ideal course of action. I don't know what it is that you enjoy the most. Maybe you enjoyed surgery. And so, with your background, there is a business opportunity for you. And you don't even necessarily have to leave your current job if you've already got a job as you're watching this. But you're like, okay, I can start something part time, because when I think in the future, by the time I retire, I want to leave something for my children. I don't want to just leave them a pension. Maybe I want to leave them a business. I want to leave my family a company. It may not be that, we all do what we do for our own reasons. So listen, get in touch with me. There's a link somewhere below. I appreciate you. I'll see you on the next video.